that book, you know, I used to keep a notebook with all the different diseases. You know, if I got a herpes case, I put the name down immediately and the
Okay.
date when they came in.
Did you put the type of treatment down there too that you gave?
No, I went back to the charts.
Then you went back.
See, I will
Change
always
the type of
refer back
patient.
to the charts. There she is. No. Yeah, here they are, right here, damn it. Ah, herpes. Here, look at this goddamn thing. Yeah. Boy. Here, see, here's some of the stuff. Here, log. Yeah, herpes zoster I had, they were tough because they used to get post-zoster neuritis. Now they don't get it so easily.
What did you use on herpes zoster?
In those days, we
Yeah.
used protamide,
Okay.
but not everybody responded, you see. Some people, herpes simplex, here they are, look at this damn thing.
What do you use now for zoster?
For zoster, now they have Zovirax, they won't take anything else. See, they have the tablets, they say, oh no, don't take 5 a day, take 8 a day, and you'll find that it's much better. Well,
Do you use that?
no.
What do you use?
Well, I have to give it to them. I usually like to give them even autohemotherapy. But you can't do that because their neighbors, their sisters, their relatives will tell them, wait a minute, there's a new medicine out, you have to have that for shingles. If you don't give them that, you're a horse's ass.
Have you had some cases with autohemotherapy? You mentioned that you did some. Or?
Oh yeah. Let's see. Oh boy. Let's see, look at the damn stuff I have. Herpes genitalis, herpes simplex, right side. Right, 583. That's the risk. See, herpes zoster. God, I have tons of them. Yeah, herpes simplex again, Simpkin. This is 78. Herpes. Look at the damn stuff. Herpes. God. Got that. Recurrent herpes simplex list. Last visit 83 since 4 or 5 times. Mrs. Gill, now pregnant, birth. See, with herpes on the buttock, see, there was a woman here in 89, had herpes on the buttocks, but she was pregnant too. I had to talk to her OB man, tell him what the possibilities are. Sometimes it'll affect the fetus. Herpes Pickering, pubic area, hematoma, Bonnie Pelton. Here's the last one I was treating, Bonnie Pelton. Upper inner left thigh she came in with, that's 1290, see? 1290, she came in. She comes back every once in a while. She used to get that damn thing up in here, see, on the side of her thigh.
Is that an autohemotherapy case?
Yeah, oh yeah, she got autohemotherapy because she came in the 90s already. And she loved it because that damn stuff cleared up. But it's one of those cases, well, she'll give me $20, you know, she's not working, she's a comedian.
That's herpes simplex.
Yeah, but it's goddamn tough because it happens on the inner thigh where it's very painful. Yeah, very sensitive skin there. Did you ever get pinched on the inner thigh? You know, this was an old trick. Boy, you want to really give somebody something, you pinch them on the inner thigh. Under the H's, yeah. So difficult.
Urticaria, you got any in there that...
Let's see if I have it under urticaria hives. Here we go. Put me in the same thing. No, I don't have urticaria here. I'm going to look over it. I mean, I don't have it in hives. Enzyme reprint. Yeah.
In the case of, you say you reserve autohemotherapy for more difficult cases of urticaria.
Yeah. Because nothing helped them, see?
Well,
and damn it, that doesn't help. It does help them.
Well, if nothing else helped them, and autohemotherapy helps, then wouldn't it seem, and you feel that autohemotherapy is harmless as far as doing any harm to the patient?
No, you can't have any very bad effects from your own blood, none at all.
Okay, so wouldn't it make sense to use autohemotherapy as a first resort instead of a last resort?
Makes sense, but you can't use it.
What would you use?
You'll use it because you're living in this generation.
In the first instance in urticaria, what would you use?
First interest? Oh, well, then I would, it depends on where you find it, what part of the body, what are they taking in the way of medication. See, it depends on the things they're eating and medication to start with. Then it can come back to contact with detergents. There's so many things that'll give you that you got to sit down with the person, and you can find it out about the third treatment when they say, yes, but I didn't think it had anything to do with it, so why should I tell you, doctor? That's why I didn't tell you. I didn't think it had anything to do with it. I said, well, you let me ask the questions. You see, now it finally came out, but it took 3 visits to get you to tell me just what's doing it to you. It's so difficult.
It's 5:50 now, doctor. Is your
5:50?
wife going to be downstairs at 6?
The what?
Your wife is coming at 6?
Well, she'll call
she'll
me.
call you first,
Yes.
okay.
So it'll take her another 15 minutes to get here. Hair loss, hand eczema, herpes zoster, herpes. Vidarabine for early herpes zoster. I mean, you took away the things that worked. What are you going to do? Very difficult because you see, when it's done at a university and they're doing it with 10 cases and they write it up, nobody's going to listen to anybody that's trying to knock at the door. Herpes, who the hell is this? Bradshaw, Zalkin, okay. These are all herpes zoster. Right up. Begin papaya tablets over here. This is hydroadenitis suppurativa, another case in 87. Herpes, pubic area, autohemo, and husband. Aphthostomatitis. Aphthostomatitis, that's the ulceration in the mouth, is also a form of herpes, but it's occurring on the mucous membrane.
You use autohemotherapy for that?
Oh yeah, yeah. First you give them something like Orabase. Orabase acts like a Band-Aid on it, you know, it'll cover it beautifully. If you put some on there, then you don't mind eroding it more with some kind of food. So it acts as a beautiful cover. And then you can give them the autohemotherapy, sure.
Are there any patients that you would see that would coming in the door, the first thing you would try would be autohemotherapy?
No.
No. You use it basically as a last resort?
Only if they've been to many doctors, see? They've
Okay.
already had a lot of treatment. Then I would be bold enough to say, well, I'll tell you, if you're smart, you don't need any medicine, let me do this with your blood, and so let's see how it helps. And they get results sometimes. So many things go down the drain, you see. How the hell am I going to get somebody to listen to me? You write it up here, you write it up there. I sent out stuff. All the letters that came back were terrific. stuff here, but
The first reference from your friends in Michigan, Pennsylvania, was it, where you first heard about autohemotherapy? Or you were talking to them about it? Was it in the context of herpes simplex?
no,
What's your
I
earliest?
told you, in those days, I got it out here from Dr. Oh God, one of the Alzheimer's. And then he wrote it off, would you believe it? He started to treat herpes simplex with the smallpox smallpox vaccine, and then he sort of backed away from it. Trying to think of his name for the moment. But he was his son, he's got a son now that's here. He was junior. They're all up to the age of 93 or so. He was junior. And then his son was number 3. Junior means you're the second offspring.
Was it in the context of herpes simplex that you that you first encountered autohemotherapy?
Yeah.
Was as used on herpes simplex?
Yeah. That's when I started to use it frequently, because I saw the results that were coming in. And that came in with the disappearance of the smallpox vaccine. So many things that'll give you an urticaria. Oh yeah, I was going to go over to STUV. Yes, let's see. Do I have urticaria written up? No, UV. Let's see, come on with hard.
Now, the way that you had learned about the treatment, it was once a week, 10 cc's generally? Is that the general course of?
Yeah. It's only recently I heard about the Russian method, where they start with 1 cc and then increase it all the way down.
How often do they give the?
Maybe 2-3 times a week.
Yeah, the Germans too, I think.
Yeah. Why are they angry at us people that make medicines? They're trying to take away our income?
Well, the Russians, maybe they couldn't get the medicine. They had to use that.
I think so, because it's the simplest medication to use, and it's the least toxic.
And the Germans probably because they were going to try to patent it.
Huh?
Yeah, Germans probably because they were trying to patent it.
Yeah. Shit. Darn God. Papa.
In all of your experience with autohemotherapy, have you had any negative results?
With
I mean,
no,
people that got worse or got sick or?
not with their own blood, no sir. No. Let's see, what the hell was this pregnancy?
What's the longest course of treatment that you've administered? How many, as far as the maximum number? I know the minimum I would assume would be 1 shot.
Oh, no, you can't.
No?
No, you don't get better in 1 shot.
Okay.
You gotta increase the dosage or get them multiple doses, over a period of a month. They should have at least 5 or 6
Okay.
shots, yeah, at least.
Okay. What's the longest course of autohemotherapy that you've administered?
Oh, I used to have people coming in over a period of years. They'd come in, I think I'm going to get, I better not take a chance. I think I'm going to get a herpetic lesion on my penis. So they come in, get a shot of their stuff, and they'd call me up a couple of days later and say, that damn thing went away. See, that was their medicine. They understood it, and they believed it. See, and they saw the results.
As a general rule, a patient coming in, you've decided to try autohemotherapy, would you tell them that in terms of like how many injections they might expect?
I'd say you'd need about 4 or 6 of them. See,
Okay.
at least, yeah.
Okay, so you basically look at that.
Yeah. I
treatment
said,
regimen.
you'll see for yourself. I don't know whether you'll feel better after the 3rd or 4th one, and whatever is there may start to fade away. If you want to, you can skip a week. You don't have to come in every week. As this thing starts to level off, then you come in every third week, every fifth week, and as it disappears for a while, but you'll know that that same area is going to become a little bit active. You'll know, you may see a red area around there, or you may feel that looks like this thing's going to flare up again. Better get some of my own blood. See, they know what to go for. Now your idea is to teach them how to use a syringe on themselves, you see, and they can give themselves the treatment. Now it couldn't be anything better.
It seems to make sense. You know, it reminds me,
See, it makes sense, but I'd say I would get an RV,
an
recreational vehicle, and take it over. They used to have it over at the Town and Country to take your blood pressure, see. Now I'd go out there as a traveling dermatologist for difficult conditions.
Give them shots of their blood.
And I'd stay around, well, what are you on, Medicare, Medi-Cal or something? Well, I don't know. I'll give it to you for nothing. If you got $3, I'll give it to you.
That's what somebody said that in Germany. It's a real inexpensive treatment. It's like I think Danette said she got like 3 treatments for the equivalent of $10 US.
Well,
autohemotherapy,
you don't
but
need
they use
it
it
anymore, but you
regularly.
can't, see.
Yeah.
The trouble is, oh, you came to see the doctor? Oh, you had an office visit? They'd shoot you.
You got to, yeah. Well, you got rents.
What do you
the
charge
rents
for
have
it,
gone up
huh?
so much. Rents have gone up so much. What are you gonna do?
Oh, well, see, the place that you do it now, if you get a traveling office, that's another story.
Yeah.
But with that kind of an office and the kind of work you're gonna do, some wise attorney will say, wait a minute, we got a good guy we can take over here.
Well,
We can pull him up, whatever he's gonna do. You have to have people that you can trust, see, too.
do you think that, I mean, it occurred to me, and maybe this is correct or not correct, that there may be some relationship between Bonkus, the cups, and autohemotherapy?
Oh, Bonkus, you mean?
Yeah, Bonkus,
Almost.
because it brings the blood to the surface.
That's right. See,
Yeah.
you get a hematoma there, and it's not in the circulation, but you still got this stuff. Now here, geez, let's see what the hell this looks like.
Have you ever had autohemotherapy done on yourself?
You see what's happened here?
What is
I
this?
killed myself. Look at that. Look at that cut there. You see?
Let's see, I can't see it.
Terrible. See, it's dry now.
What, you
But-
cut your hand or what?
I hit it into a piece of wood, furniture, and I put it on there. But here's what's happening to it. You know, it takes a long time to heal up. But in the old days, they used to give them vitamins. I mean, papaya, for when they did a nose. You know, and the people got a hematoma around the face. The only way you
Right.
could clear it up is. You never ate these?
Oh yeah, I've had some, but thanks.
Wow. 3 is a nice dose. They're chewables.
Papaya.
Now,
Right.
I've taken this 3 times a day. And ordinarily, I get a black and blue mark that stays forever, but you see, this is really a traumatic one.
Oh yeah.
Oh, look at that, where that cut that, her thing's ripped back. I was able to pat it down. Gonna put the same thing back again. Although I should have another one on there.
It'd be good to put a clean one on though.
It's whole, it's gonna repair beautifully, and it's not infected, but the hematoma is fading out. I had this happen to me, I think it was Wednesday morning.
Here in the office?
Oh no, Tuesday night, just before I went out, no, at home.
Yeah.
Tuesday night, I went past a piece of furniture, and damn it, the whole thing stripped off like that. Then I went out and played golf. Wednesday, yeah, yesterday, Wednesday. Now it's going to be 4 or 5 days. It's Wednesday, Thursday, Friday. I never saw a thing heal so fast. Like this is losing all the hematoma under it, thanks to papaya. And an enzyme will clear up so-called subcutaneous blood.
Have you ever had autohemotherapy done yourself?
No.
No.
I didn't need it for anything.
Yeah.
Didn't need it. It's so trying.
Oh, that's good. That's good.
See, here's my records of all. Holy hell! Here's a bunch of guys I took care of. See, see what they're called? Draft boys. Draft boys.
Oh.
I didn't want to go in the army. I didn't take care of Clinton. But the attorney used to send them over here, see? And I had the manual for the medical manual from the Army. And there are certain conditions which they absolutely will not take you in for. However, if you are in a draft call and you go over to the local man, they need bodies.
Yeah.
This
yeah,
area
fill
has
their
to
numbers.
give up. We got to get 30 men out of this area at least, because we've got so many areas. We got 30 men we need. Well, whoever came in first was taken. And then later on, they found that they had a cripple almost. The guy come in to me, I shake his hand, see? I said, you don't have to go into service.
How could you tell by shaking his hand?
Hyperhidrosis.
Oh, okay.
His hand was sweating. He's the kind of fellow that has sweaty hands. Now, the write-up there is simple. I said, you take a man like that, you give him a rifle, a polished rifle, butt, and if he has an emergency or he has to contend with another person with a gun or something else, he picks that rifle up and it starts to slip in his hand, he's going to be a dead man. He cannot hand a polished rifle. It's enough. Cut him out. I couldn't understand how, just by shaking his hand. I said, how do you shake hands with people? He says, like, well, he says, you know, I feel badly. I said, here's the way you shake hands with people. Yeah. You see, you wipe it off on your clothes. Don't let them see it, but if you're getting
Do it
ready to
quick.
shake hands,
Yeah.
you got half a hand. And there's some women that couldn't play cards even. The darn stuff was so wet. You can't do a thing with that. A very, very difficult thing. You can put all kinds of hyperhidrosis, excessive sweating.
As I recall, there were some cases of that in the autohemotherapy, automedical
Possible,
index.
but
Yeah.
it's really a function of the glands. I don't know what you can blame it on. Shucks. Sorry, I don't have these things. Ay, 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 ay. Yeah.
Okay.
Just. I'm gonna come over here tomorrow.
Coming back over tomorrow.
Just to straighten out this goddamn desk. It's so crap. Now, Retin-A is coming out with an apology, see? Ortho has decided to phase out Retin-A regimen kit, which includes both Retin-A and a sample of Purpose Dual Treatment Moisturizer. As of April the 1st, 1992, no regimen kit product will be sold by Ortho to the trade, pharmacy chain headquarters, or wholesalers. Please know that we value our relationship with you. We are committed to being sensitive to your wishes and helping to satisfy your needs. We hope our decision to discontinue the kit will serve to confirm this with you, which means that they're not selling it over the counter. Leave it to the doctors. Look, we're taking it easy. We're making these people go to the doctor. Look for the doctor. Very difficult. Very difficult. Oh boy. I thought I had some good slides for that. Oh, I had some excellent results with that. Damn Papaya. And the autohemotherapy sometimes. Shucks.
To a young doctor, we may have covered this to a certain extent, but we'll try to get this phrased. To a young doctor coming out of medical school, he's not been exposed to autohemotherapy at all. Well, that's your wife, let's get that one, and then I'll wrap it up.
Hello? Okay. Right then. Hello? Hello? I don't know why both lines hit.
Yeah. So what's it take, your 15 minutes?
I think about 10 minutes she'll be up there, yeah. She's leaving, so that means she's going out the door. And we have to go to dinner with somebody.
Okay. Can I get maybe a 1 or 2 minute statement on autohemotherapy? It's a young doctor, he's never heard of it.
Yeah.
And you want to just inform him briefly about this practice, and then what would you say to this guy, just to let him know you probably never see him again, but you want to give him a little
Well,
bit.
it all depends on where he's going to practice. If he's going to have a practice in a small town where he's going to be the physician, then he can use it. If he's going to be in a big town and try to use it, the pharmacist won't like him.
Okay,
See?
so does that mean he shouldn't take a chance, or what would you say to him? That he's just going to come out against some resistance?
That's right. It's very, very trying. That's all I can tell you. It's a damn tough job. All right, I just gotta move.
Okay, but is it worth it? Is it worth trying?
For a young fella, if he's got the courage to do it, yes. He's got to have the courage to do it. By what right does he have to do that? They never taught him anything like that in school. Nobody ever mentioned it to him. And here he hears this wild rumor that somebody's making some success with this stuff. Think it's fair? No. It's not fair to a beginner.
Okay.
I asked that on the speakers on the platforms. Now they're using bone marrow. You see, bone marrow from somebody that's in the same category as you are with all the different parts of the blood. It works. And that's a form of autohemotherapy. Not autohemotherapy, but it's the stuff in the blood, in the bone marrow. Where is the blood generated from? The bone marrow, of course.
Okay, well, whenever you're ready, I'll walk you out. I don't want to
Okay, yeah.
just let this thing run.
I gotta come in here tomorrow and spend more time. I just can't take it.
Blame it on somebody else.
Huh?
Blame it on somebody else.
I'm sorry.